also to present our board of directors, the community board of directors. And I would have them stand, and let's hold our applause until the end. Eva Clark, Esquire, she's here with us today. Clap your hands. I said hold your applause, and I said clap your hands. You can see I still got problems, amen. Bianca Perez Bellier, she is Secretary Administrative Division of Aging at Brigham and Women's Hospital. Mash Ibrahim, he is Treasurer and owner of Butterfly Cafe. Mrs. Omalara Benkole, she is a retired nurse. Miss Monica Johnson, a teacher, a lawyer in the Boston Public School Systems. Cindy Walker, she's a patient and a well-known activist here at Whittier. Miss Alicia Wetterberg, she's a science content specialist, Office of STEM at the Department of Secretary of Education. And Miss Aurelia Williams, who is a retired right now and serving as a patient and a member of the board. Let's clap our hands for the board. Thank you very much. And at this time, I would like to bring to you our illustrious President and CEO, Miss Frederica M. Williams. We are excited to have her, and as she comes, I need to say on behalf of the board of the tremendous amount of appreciation and respect we have for Ms. Williams, her administration, and this amazing staff at Whittier Street Health Center. What an amazing group of talented, committed individuals. Let's clap our hands for our president and CEO.
Thank you. Thank you, Pastor Bell. So, welcome to our annual meeting and Black History celebration. This year, I mean, the last 2 years of the pandemic, or 3, feels like a lifetime, has really, I would say, validated the work that we've been doing over the years, focusing on addressing racial and ethnic disparities in healthcare and the social determinants of health. So for last fiscal year, we chose a theme of, it's not, we should consider health equity, we may consider equity, can we consider equity? We said together, we must achieve health equity. Now is the time. If after the pandemic and all of the lessons learned, we don't make systemic and institutional changes, we will still be talking about the life expectancy of BIPOC communities, the social inequities, and all the rest of it. So we are seriously focused on, we must achieve health equity. In addition, we recognize that we can't do this alone. And that's why together, it's a partnership. We have to partner. We have wonderful cross-sector partners who work with us, including our patients and community residents. So I just wanted to share a highlight of the things that we accomplished last year and over the last 85 years of Whittier. And one of the quotes in the annual report, and all of you should have a copy of the annual report, is, I said, the time is now for all our leaders, community members, policymakers, business leaders, the city, the universities, the hospital, all of us from all corners of Boston to take part in the rebuilding of Boston free of racial, health, and economic inequities. And so when we have so many things happening, we have a wonderful team. I'm celebrating my 20th year this month. I can't even believe it. walking through the doors of the old building, and I'm gonna ask Rukia Ali to stand. I was coming in for my interview, and I saw this beautiful African woman with her hijab and all the rest of it. And I said, this is the place, I wanna be here. And so it's been wonderful to have a team of Rukias out in the community with people from all backgrounds. And she is respected as an elder in the community, and there's so many of us. So the focus in this year's annual report, we focused on investing in our youth, strengthening mental health, promoting healthy living, but also hearing from our providers, reflecting on the community, looking at the issues that pediatrics patients are facing, behavioral health. Fortunately and unfortunately, I hope that the stigma around behavioral health, mental health, and substance abuse as a disease are being removed, but also highlighting some of our corporate partners. So it's wonderful to start with the young people because those are the future of Whittier Street Health Center and our community and the work that we're trying to do. And our first patient is Gabby. She's a 10-year-old who, as you know, those of you who are working mothers or have grandchildren know that the pandemic has been challenging for our youth. But her future goal, despite being stuck in front of a computer trying to do virtual schools, she has goals and aspirations that she's discussing with her pediatrician. And she wants to be a fashion designer. So, but since the pandemic began, we've seen increased anxiety rates, suicide ideation, weight gain, developmental delays, even weakened vision. Eye care folks are telling us that the amount of time children are spent in front of the screen is impacting her health. And so she was exhibiting things that her mother was concerned about, Tanisha, and she brought her in to see Dr. Olutu, who is a pediatrician, who herself is an African-American, a female, but also a working mother of 2 young children and can relate to the issues that parents are experiencing. And so last year, Brenda's team, the behavioral health team launched, we expanded our behavioral health services, we implemented care coordination, we launched virtual fitness and nutrition classes. The pediatricians were telling us that after the time of isolation, when children were presenting for their physicals, they had gained so much weight. And then we also were referring children to social services to ensure academic success and overall health. And so Gabi can reach her full potential, and she's happy and she's thriving thanks to the partnership with the school. We have a school-based partnership, but also a partnership with the integrated behavioral health and pediatric team. And in addition to the care that we provide at both of our clinics here at 1290 and on Blue Hill Lab, we also have school-based clinics at the Boston Day and Evening Academy, Dudley Charter Initiative School, the Dearborn Academy, and the Epiphany School, and we are expanding. Someone from Randolph just reached out to me last night about even expanding to Randolph. And again, investing in our youth, we have Miss Matilda Drayton here. Matilda is the president of the Tenant Association at Alice Taylor Haywood Development. And I can tell you, she is a force to be reckoned with. She is a fearless champion for Alice Taylor. And she just was, in 2020, as people were isolated, sitting around, not having things to do, she's always looking for ways to get her youth engaged. At Alice Taylor is a large development. And she, on her own, reached out to a state senator and said, I want to work with Whittier to expand services in local neighborhoods, doing gardening, working with Toriano. Tori, our youth coordinator over there, we have our youth development team, and said, you have to support them. So I got this mysterious phone call from a state senator, Brownsburger, saying, we're sending you $90,000 because Matilda said we need to invest. So when I talk about together we can accomplish health equity, Whittier just has a way of just getting things done. We put together little pennies that become dollars, that become thousands, and we don't ask much. But Matilda saw it. And by the way, she's my namesake. My middle name is Matilda. And so Matilda saw it and she's like, we're getting this done. And so we're working with the youth. Tori, we've been out there, we're doing groups. In addition to having our youth development programs here, these are programs that are out at Alice Taylor. And she not only wanted to focus on the young school-age kids, she also wanted to focus on the young adults, a lot of brown and Black men under the age of 25 who were unemployed and just sitting there and not doing things. So thank you, Matilda, for being a part of the work we have to do to accomplish that. We, as you saw, we had 23,000 outreach visits, including what I just mentioned with Matilda. 28% of our patients are still uninsured. 82% of our patients live in public housing. 87% of our patients present with psychosocial issues. What we do is we screen patients not just for their health conditions, but for their social issues, whether it's housing, whether it's employment, all of the things that impact people's health. Hi, Abdi, how are you doing? So that's Abdi from the Somali Development Center. Yes. Another brother that I've known for. So last year we provided 175,000 clinic visits. So the team was very busy. I want to introduce our medical director, Dr. Stephen Wright, who was a key, but also our director of nursing, Melissa Liston. So Melissa, Melissa has been with us she was a new nurse when we hired her, 15 years. And I will tell you that when the pandemic broke, the testing that you saw all over the community, the vaccination, rain, snow, sleet, any weather, she was out there. And then in August, she decided, you know what, I live in Brockton, I want to move to work in Brockton. But when people leave Whittier, they always come back. This is home. And we make sure when you say you need a break, we give you such a send off. We praise you, we adore you, we know you'll be back. So we're glad to have you back. She was only gone for a few months, but she's back because this is where she belongs. Melissa grew up in Jamaica Plain, similar circumstances to our patients, and has been a role model to our patients. So thank you, it's wonderful to have it. So we were, very busy. As you can see, for health center, we do our best to get our men in for care. 44% of our patients are males. In health centers across the country, men make up single digits of the patients at the health center. But as a mother of 3 sons and our focus around men's health and the fact that we know that the average life expectancy of our men is less than 70, we've put the effort to increase access for our men. And it's wonderful when we have group visits, the men are equally as vocal as the women, and they don't allow the women to drown their voices, which is great. So, we are. And then focusing on mental health, I'd like to introduce Gloria Bolden. She's 63, she's a 63-year-old wife, mother, and grandmother who made, an effort, to focus on her mental health. She mentioned that at a younger age, she experienced some traumatic, oh, there's Gloria. I know I saw that. Come on, Miss Gloria. All right. So maybe you tell your story,
First of all, I was 60.
mentioning ages.
Well, I've been coming to Whittier Street since Ruggles, since over there. This clinic, I mean, it supplies everything for me and my family. And, you know, I've gone through something in my childhood that still revisits me today. If it wasn't for this clinic and the counseling and, you know, everything that it offers, I wouldn't be standing in my right mind. So I'm very excited and blessed to be here. You know, I've gone through a lot and Whittier Street has been with me the whole way. So I am thankful so much. I tell everybody about this clinic, family, friends, everyone. And I'm just, you know, blessed to have Whittier a part of my life.
There's no way I could have shared it. And we thank Christine Pajorillo, who's our Vice President of Program and Social Services and works with them. Yeah. And the quote that I like is she said, I learned having courage means you step out and do something even though you're afraid. I carry that with me every moment like a breath. Thank you. Oh, and there. The youngest senior we had in the house, Miss Attorney Eva Clark. Yeah. Talking to her. Can I tell your age? Okay, okay. Last night I called her and I was speaking to another person who is of similar age, and she was like, oh, I'm aching, I am sick, and then I spoke to Miss Eva and she's getting ready to jump on the disco floor. I mean, it's like, Miss Eva, slow down, I'm tired. I mean, and she just says, and it's all about a state of mind and who she is as a vibrant, loving person. What she does, she's an attorney by trade, she's retired, but I met Eva through our prison release program more than 20 years ago. She goes into the prisons and jails to advocate for people, still are. And so through our prison reentry program and the work that we were doing around disparities, she and I facilitated several work groups 20 years ago. And then our paths crossed again 5 years ago. So she has been promoting active living. She has the Club 1290 group, and she'll tell you about that afterwards. But the Club 1290 ranges from age 60 to 95. Yeah. And they had a meeting last night, and I will tell you that the young folks, including our fitness coach, cannot wait to go back upstairs and take a nap after they've met with us young citizens. And what we're doing here is teaching people that we can be healthy at any age. When we started looking at the data, the Boston University had put out a study that said the average life expectancy of a person living in Roxbury is 59.5 years, compared to the average life expectancy of somebody living in the Back Bay, which was 92 years. So there's a 33-year gap. And folks are like, well, there are a lot of things. If your housing situation, if transportation, if your job, and just the life of living while Black itself is a stress. And trust me, we take off the suits and we dress differently. We feel it, we know the stresses. And then the Boston Public Health Commission updated. So we started raising awareness around that in 2015. And then the Boston Public Health Commission produced a report, I believe, 5 years later, that said the average life expectancy has increased to 65 years. So what I'm saying is, we're not taking credit for it, but changes can happen if we work together through our community garden, through healthy living, through prevention and wellness, getting your physicals, getting your COVID-19 vaccinations, coming in for care. We have this vibrant group of people that are proof positive. And the fact that now the Boston Public Health Commission is saying the average life expectancy is 65 years old, that's still not good enough. But it's what the work that people like Eva are doing. And she brings folks in who would be saying, oh, my knees are hurting. But by the time Eva is done with you, they're dancing. They're doing Jerusalem, you know, and doing Zumba, you know, but also providing information and talking about real issues, about diabetes, about hypertension, about mental health, about substance use disorder, and bringing them. So, you know, she is proud to serve an organization that cares for her personally and for her community. And she says Whittier is still growing and evolving and doing what it can to solve the great issues. We are here to pursue happiness. So Eva came to Whittier as a well baby when we were a well baby clinic. And in my opinion, she's still a healthy baby. And then we also, you know, profile physicians. Dr. Arturo is a Cuban American who, in what he says is, he can relate when, for many of us that are immigrants, when you first move to the United States, you got to start from, it doesn't matter what degrees and credentials you have, it's a challenge. And so being able to share that experience and to be able to speak to our Spanish patients and to assure them, well, what he says, you know, as a primary care provider, she feels like every primary care provider is a psychiatrist, because as much as you're focusing on diabetes and hypertension, there are all these living issues that you have to address in the visit. So cultural competency and having staff that reflect the community is critical to addressing health equity. Unconscious bias is a major issue. When people form an opinion, that's why we're grateful to have Dr. Bisola Ojikutu as a executive director as the chief executive director, CEO of the Boston Public Health Commission. Having someone who understands the racial, the systemic issues and has a commitment. Sometimes people understand and don't have the commitment, but having both is critical to addressing health equity. And then Dr. Olutu Adetokunbo, another immigrant, she's a pediatrician, and Dr. Adepoju, she also, your Nigerian people are represented. Your Nigerian people are in there, and they're your tribe to your people. Yes, so we should connect to it. It drives my son crazy that I know where everybody is from. He calls me the United Nations. So yes, we do, and that makes a difference. I mean, think about as Black people talking about mental health and substance abuse and what the barrier to behavioral health too, and we have Nixon and the behavioral health team, is many times people are being treated by folks who don't have the cultural competency, don't have the compassion, and that's what these our providers do here at Whittier. And again, we had a lot of corporate partners, and you see, this is Miss Matilda here, that key voice. She's as important as the Liberty Mutual Foundation, the people that provide the $1 million grants. Having that $1 million voice in the community is critical. But also, we worked with the city on the Health Equity Now. I was one of the co-chairs of that task force that met for 2 years to develop that. Cigna supported, they reached out to us. We know that caregivers typically are under burnout. So we have a program, a support program for caregivers. LGBTQ, the data that shows that the average life expectancy of a minority LGBTQ is 35 years. A lot of them are facing mental health issues, homelessness, stigma. So we created a safe place with Christine and her team for the LGBTQ team. And Northeastern made generous PPE donations. And also, we were active in the community with the mobile vaccinations, the pop-up clinics, and we worked with a group called Health Equity Now. When we started the vaccination, people were being asked to provide IDs, and that was a barrier for our community, many of them. And we worked with the Health Equity Now team to advocate to the governor to say, when people are going in for their flu vaccines, they don't have to show an ID. Why should someone then have to show an ID for the COVID vaccine? If you're dealing with vaccine hesitancy and resistance, that's one more barrier. And the state heard us and removed that. Pastor Bell and Reverend Culpepper were critical in bringing the Black pastors here. We were able to partner with the churches. We held focus groups with the Black ministers and Hispanic churches during the COVID testing, but as we were preparing for the vaccinations, we did community focus group, public housing focus groups, but also worked with our pastors, because if they put it as part of the sermon, we know people will come and get their vaccinations done. And so we worked with the lawyers for civil rights because it was a civil rights issue. And Bob Mahoney, we have a community board. We also have a President's Advisory Council. And Bob Mahoney was the former president of Citizens Bank and Belmont Saving, and has been, again, it takes all people. He lives in Wellesley, but he sees Whittier as his home. He's been our friend for 20 years and supports us and helps me in raising money, because he says people like me have a responsibility to fight for health equity for everyone. So we expanded our mobile health team. We bought that massive van there with 2 exam rooms, and we're able to go out and provide services, partly funded with the American Rescue Plan and a vaccine hesitancy. There's Dr. Wright there speaking to people. Pay me later. There's Dr. Wright there speaking to people, doing group visits to tackle vaccine hesitancy. We had to do a lot of work and still continue to do a lot of work, and people responded. And we were out. I mean, again, it takes a village. For us, it takes a whole state. We will, if you are willing, we will engage you. You will be a friend. What people say about Whittier Street Health Center team is we're nimble, we're flexible. You call us on Christmas Day and ask us to do a vaccine on New Year's Eve, from the CEO to the medical director to the VP of programs, we will all be there, because we take this health equity work. We are not thinking about it. We say yes first, and then we go behind and figure out how do we pull it together, and the team is flexible. So I come to work every single day knowing that I've had the best team in this pandemic. We've had our fair share, but we had to rebuild and be ready for this global war. And we couldn't have won this battle if it wasn't for my wonderful team. So all of these people, we have so many people to thank, and so many more. We asked our staff to talk about their work around what they're doing in family medicine. We launched our own pharmacy on the 1st floor, behavioral health, infectious diseases and special populations. We won a major grant from Shamsha to implement HIV, mental health, and substance abuse screening for the homeless, including mass and CAS. Quality assurance is critical to what we do. Finance, if you don't have money to pay the bills, it doesn't happen. But the food pantry during the pandemic, when everyone shut down, we were open. We had an emergency daycare, a food pantry we expanded to everybody. And it was eye-opening to see the face of hunger. Regular people that were struggling, and we were thrilled to be there in our satellite clinic. We received a lot of certification. These 2 colleagues, Moses Stewart is a data coordinator, because you can do all the work. If you're not able to report it, then it's not happening. And John Nichols is our director of patient financial services, who's been with us for 21 years. Again, this is our financial profile. Last year, we provided $1.2 million in free care. 38% of our revenues are from patient service revenue, and 62% is from grants and fundraising. So it's a lot of work. So, but we always, we do whatever, but viability is critical, because if we're not viable, we're not going to be able. Everyone's talking about the great resignation. We've not experienced that, because and don't you guys have any ideas now? I was, okay, you guys know me. I'll put a chain to your, but when you recognize people and you empower them and work with them, but we were able to generate a surplus in the year, which we invest. We're not in the business of for profit, but you don't want to be so strapped that you're not able to do the work. And so having the financial flexibility, I will tell you that in the 20 years that I've been the CEO, we have always had a positive balance. And someone that you don't hear a lot from is our CFO, Jim Lee. Yeah. So Jim, again, is someone I met 25 years ago. I tell people now he's so serious. I said, if you know what Jim was like when I met him 25 years ago, but mentored and nurtured him. And now he's my partner in good things. I would say. In crime. So just a wonderful year, thanks to our board, thanks to our President's Advisory Council, thanks to our senior managers, thanks to our staff. We together must address health equity, must continue to do the work. While there's much to be celebrated from last year, there's so much more to do. So we're not resting on our laurels. We don't want to be commended. We just want to be able to pause and say, this is what we're doing, and have you challenge us to do so much more, because there's so much more to do. And that's it. And in the midst of all of that, we also launched our 5-year strategic plan with the board. And then we also revisited our Boston Health Equity, where we updated our own, we changed our mission statement to focus as a center of excellence that is focused on health equity, social justice, and the economic inequities for diverse population. And our vision is to impact life expectancy. And to do that, it's how we provide care. I mentioned that for every person, whether you're coming in for an HIV diagnosis or whatever, we screen your social, this is a population in public health, our population health management system, how we're going to accomplish health equity. It's one thing to sit here with your strategic plan, but we want to be able to measure it. 100% of our patients will have a well visit. We want to measure how many of our patients will have an A1C under 7, very specific measures, so that by 2026, every year, we look at this every month. By 2026, these are the goals that we hope to accomplish. You know, whether it's the emergency room visits, whether it's reducing ER visits for high-risk patients, making sure we're following up with people 2 days after they're discharged from the hospital, but also focusing on sexual orientation and gender identity and screening for that, looking at social determinants and making sure that 100% of our patients. So this is what we will be reporting to you every year as far as the clinical goals that we have to accomplish. Because the fact that we've set those big goals is because there's still gaps. And so there's so much more work to do. And the way to address health equity is to focus on these health issues for our adult patients, our pediatric and adolescent patients, and for our community. So just more pictures of all the events that we did, Black History presentation being one of them, our Boot to Bad Health, our World AIDS Day, our employee slice of thanks and a turkey giveaway to the community, Martin Luther King Day of Service, where we give out food and warm clothing. Just always in our back to school barbecue, which is a popular LGBTQ celebration in June, Hispanic Heritage Month, Men's Health Summit, and also a federal press conference. So the Black History Month is a time when, you know, African Americans are generally at risk, higher risk for heart diseases, stroke, cancer, and all these things that are there. And we want to bring attention to it. Every day is Black History Day. And we don't need to wait until February for that. So that is my presentation, and it is now my pleasure. Pastor Bell didn't know I was supposed to do the presentation. I'm like, you're here, you do it. Yeah. So he's going to be introducing you. It's here, we have it. Oh, you're good. As soon as he's done, then I'll sign it up.
Oh, thank you. Let's clap our hand for such a powerful presentation. And before we introduce our keynote speaker, we need to just have a few housekeeping moments. There is a board member that I left off because he wasn't on the board when the programs were printed, Pastor Vincente Castro. He's pastor of Strong Tower Church in Stoughton, an amazing individual who is a leader in his own right from Puerto Rico. He's recently joined our board. And also, if he's online, I wanted to recognize and welcome those who are joining us via Zoom or a closed meeting. So I wanted to welcome them as well. And as I'm about to introduce our illustrious keynote speaker, I just think that Miss Williams, and I call her Frederica, but she is Honorable Miss Williams, because I think we take too lightly our president's report. When you look at those of you who've been in the city of Boston and seen the type of leadership that has come and gone, this leadership team and all the people around her, and I'm so glad Melissa's back because I don't want any HIPAA violations because I am her worst patient. She's like, oh, crying out loud, him again, amen. So, but I think we need to stand up and clap for Miss Williams. Come on, y'all. Come on, people, this is the real deal. We truly appreciate you. And thank you so much. Amen. And even though I'll be 63, I'm not going over there with them old people with even them. Amen. I'm going through like my 98-year-old aunt said, I said, hey, Kelly, you old. She said, I ain't going over there with them old people. So as our keynote speaker comes, I need to tell you why it's important that we celebrate Black history, why it's important that we commemorate and educate. 2 weeks ago, in the middle of my sermon, to make my living speak, I'm railing and railing on, and I jumped out and said, don't be an Indian giver. And something clicked. You've just slandered an entire race of people with a colloquialism that we have taken for granted. And I apologized, and I felt like I was 2 inches tall. We must do better. Amen? Amen. Oh, we're not in church, I'm sorry. Let's move forward. Dr. Bisola Ojikutu is the Executive Director of the Boston Public Health Commission. The Boston Public Health Commission is the oldest health department in the United States, and its mission is to protect, preserve, and promote the health and well-being of all Boston residents, particularly those who are the most vulnerable. Whittier has had a long and productive partnership with the Boston Public Health Commission. Dr. Bisola is also a physician leader with more than 20 years of experience in public health, health equity research, and the clinical care of infectious diseases. She serves as an assistant professor of global and social medicine at Harvard Medical School. She is also an associate physician within the Division of Global Health Equity at Brigham and Women's Hospital and a faculty member within the infectious disease divisions at Massachusetts General Hospital and Brigham and Women's Hospital. Her work is focused on overcoming the structural and psychosocial factors that promote infectious disease risk among marginalized populations in the United States, including COVID-19 and HIV. Dr. Ojikutu was the director of the Community Engaged Research Program, CERP, and the associate director of the Biobehavioral and Community Science Core within the Harvard Center for AIDS Research. She is board certified in infectious diseases and eternal medicine. And we are pleased and delighted to have her as our distinguished keynote speaker on this celebration. Thank you so much.
She's also the first Black executive director of the Boston Public Health Commission. As we're celebrating history.
Okay, thank you, everyone. I'm very happy, pleased, proud to be here. I always enjoy coming into the community. You know, my office is actually on 1010 Mass Ave, and I feel separated. So getting the chance to come back out here to Whittier, it makes me feel like I'm at home. So thank you for welcoming me. I really do appreciate it. I want to also thank President Frederica Williams. No, she says no, don't thank her. Yes, I need to thank her. And let me explain why. So I started as executive director in September. And that was when we were in the Delta surge, followed by the Omicron surge. And it was really trial by fire. It's been trial by fire. And it's this woman who really stepped in as a mentor and a friend. And she's been somebody who I can just text and say, hey, I need you all. I need you to come help me with something. And you all have been there. And I think that in and of itself is something that I'm really grateful for, you know, and I thank God for giving me that, you know, as I've done this, you know, position and transitioned into this new position. So what I want to talk to you about today is our collective effort to achieve health equity. As everyone has seen with COVID-19, all of these disparities, these inequities, they've really been amplified. And I guess the question is, where do we go from here? You know, we've seen a lot, people have talked about a lot, but what does that mean long-term? And that's what I'm going to talk to you about. So I'm not going to give you too much data, but I'm going to give you a little bit because I think it's important for all of us to understand where things stand. So if you look at these data here, this is from the Kaiser Family Foundation. Essentially, all they did was they looked at 27 different health conditions, some of which are here on the side of the slide. And they said, can we compare Black, Indigenous, Latinx folks to white folks and say, are their outcomes worse, better, or the same? And of these 27, how many of them are worse? How many are better? How many are the same? And if you look to the far left of your screen, you see Black folks, and there are 19 health conditions in red. Okay, so all 19 of those health conditions are worse, Black versus white. And so when I looked at these data, I said, okay, that's not surprising. We know these disparities exist, but let me look back in history. Let me go back some years and see if this is just the way it's been, if it's gotten better, if it's gotten worse, whatever. So I look back and I have to tell you that this hasn't changed, okay? And that's what's concerning about what we're seeing right now. We're in a situation where we've seen these amplified disparities. Everybody's talked about all of this, talked about structural racism. I'm going to get to structural racism, so just hold on. We're going to get there. But what are we doing differently? What is changing over time? So let's talk about COVID-19 for a second, and then let's talk about the problem and what we can do differently. So these are disparities, racial and ethnic disparities in COVID-19 in Boston. And this has been since the beginning of the pandemic. So this is way back, you know, it feels like it's been forever, right? So this is back in the beginning of 2020. And we've had 1,686 deaths, unfortunate, really unnecessary deaths. We should know this, but let me highlight it. If you look across race and ethnicity and you say, what is our population within the population of Boston? You know, what percent of the population are we? And then what percentage of the deaths do we comprise? We're actually the only race, I say we Black people, are the only race where the percentage of our deaths was higher or is higher and has continued to be higher than our percentage in the population. Okay, so something isn't right there. And I'm not saying everybody's been affected by COVID-19, I'm not saying that, but something is very seriously wrong here. If you look by neighborhood and you look at our neighborhoods throughout Boston, we know that it's not just about deaths, it's about actual cases. So you can see the geography of Boston, and you see these are cases over time. This is the entire pandemic. And you see in the orange, that's where the cases were higher or have been higher than the rest of Boston. And you see that it's many of the neighborhoods that we know are primarily Black and brown. And then when you talk about vaccination, and I want to highlight this issue of vaccination because Whittier has done an enormous amount of work to increase vaccination within Black and brown communities around Boston. But we still have problems, you know, and I think that's going to be one of my themes here, is that we still have a lot of work to do, and we need to do this work collectively. So if you look at the percent vaccination of individuals across the neighborhoods of Boston, you see there are 3 areas, and really 2 neighborhoods, Mattapan and Dorchester, where the percent of people who have been vaccinated, this is fully vaccinated, so that first series completed, is less than the citywide vaccination rate. And our citywide vaccination rate is about 71%. Okay, so 2 neighborhoods, Black, brown neighborhoods where vaccination is lower. So something, again, is not right. This has been true throughout the entire pandemic. And another piece of this I think is really important is this issue of young people, because we're talking about the needs within our pediatric populations, particularly the needs within 5 to 11-year-olds. And you see these very stark disparities. So let me call them out for you, because I think that they're important for us to know as we talk to our family members, as we talk to our friends, as we talk to our patients. If you look at the data here, and this is just getting 1 dose of vaccine, 5 to 11 years old, and you compare white, Black, Latinx, Asian, 73% of white children have gotten that 1 dose of vaccine. 69% of Asian or Pacific Islander children. Only 27% of Black children have gotten vaccinated. Only 34% of Latinx children have been vaccinated. That's more than 60% less and more than 50% less compared to white individuals. So what's going on here? Let's talk through some of this, okay? So when the pandemic first began, you all know this is the case. The media, everybody sort of jumped on the fact that this was about racism. Now, I'm not going to say that I'm necessarily always on the side of the media, but I would say they were on point early on in this pandemic. They talked about racism being the underlying cause of what's happening, racism being the real pathology of COVID-19, racism, you know, needs to be confronted, and everybody was charged, everybody was ready to go, and they were heated. And it was in the context of the moment too, because you all know, people were protesting, Black Lives Matter, George Floyd, we're thinking about the whole context of the situation. Very important time. But let's fast forward, we're now in year 3 of the pandemic. Fewer headlines on this page and on this slide, and that was done intentionally because it's not as much of an interesting issue now. You know, they're like, okay, you know, so it was racism. Okay, well, the surge is almost over. Our percent positivity, just so you know, right now is 4.6%. That's down from 32.7. So everybody's back to normal, right? Is that really true? Okay, so look at this. So facing the denial of American racism, that was a headline recently. A year after George Floyd's killing white allyship phase, we know that that is the case. You know, it's not a hot topic anymore. You know, a lot of people have pulled back. They said, okay, enough is enough. And then we also know that the disparities, the inequities, they haven't changed as much as they should have if there was really that true momentum, that true desire for them to change. So what do we do about this? Okay, what do we really do? I think what we need to do is really understand the problem ourselves. That starts with giving it a definition. So when I say racism and I say structural racism, people talk about systemic racism, you know, people say, okay, I think I know what that is, whatever, you know, but you can't attack something, you can't fix something unless you really know what it means. So here's an easy, concise definition of structural racism, because you hear ones that take up whole pages and all sorts of stuff. You don't really need that. I think this is what you need. So it's the totality of ways, historical and now contemporary, that have reinforced a system of hierarchy, privilege, and the most important piece here is power. Okay, that is what structural racism is. And it benefits white people and it excludes non-white people. So all you got to do is remember hierarchy, privilege, and power that excludes non-white individuals. So once you have a definition, now what else do you need? So you actually need to know how to measure it. Because how can you fix something? How do you know when it's fixed if you haven't been able to measure it? You kind of say, oh, I feel like things are better. They look a little bit better. People said it's better, but no, you have to be able to measure it. So people have tried to figure this out, and there's no answer here. They said, okay, well, gold standard. Is there a gold standard way of measuring structural racism? So what do I mean by gold standard? So if you go to the doctor and they say, okay, we want to make sure you don't have hypertension. So the gold standard is somebody's going to take your blood pressure, right? So that's the diagnostic test that they are going to use to determine whether or not you have this X disease entity. So then what is our gold standard for structural racism? When we look outside our window, what do we say is structural racism? Is it housing segregation? Is it what we feel inside, perceive racism? Is it, the fact that many of us are living below the poverty line? Is it some data that's in the Census Bureau and then we take that all, make a composite index of what's happening within our communities? Is it voting behavior? Nobody really has put their finger on exactly what it is, but let me tell you this, okay? When we see it, we know it, right? We know that when you have people of one color, one race, one ethnicity in housing projects. We know when there's trash on our streets and it's not going anywhere. We know when if we're talking about immigration and we're talking about people being held behind cages because our immigration policy is disproportionately impacting people of color. And we know when we still see our state and federal prisons, as well as our local jails filled with Black and brown people, we know there's a problem there. Okay, there's a power issue. It can't just be, oh, well, it just happenstance. There is a power issue. There's an issue of hierarchy. There is an issue of privilege. There's an issue of power. So what has the Boston Public Health Commission been doing? And a lot of this work has been done in consultation, in collaboration, in partnership with Whittier, as well as some of the other community health centers around the city. So the commission, as was stated, is probably the oldest health department in the country. There's some debate, people like to say we're not quite as old as this one, that one, the other one, but we're probably the oldest. And the interesting thing about that, and one of the reasons why I took this job, was because the commission has actually been talking about equity before other people were talking about equity. So it's always sort of been out there that the commission has been interested in doing something about equity. Now, what has actually been done? Well, there's a lot of stuff on the slide. I think that's good. I'm not expecting anybody to read it. I put the slide up here because it's to say that a lot of things have been talked about. I'm just being honest, okay? A lot of things have been described and written about in papers and this one and manuals that have been put out there to talk about programs that have been named and labeled. But it's one thing to talk about, to describe, it's another thing to do. Okay, so that is what I think we need to work on. We need to work on collectively thinking about what structural racism is, and collectively making change. And I'll talk a little bit more. So if you look at this framework, so this is actually the Boston Public Health Commission's health equity framework. You may have seen it in other presentations. So we know that racism causes these or has an effect on these social determinants, because that's what everything is here in the middle, and those then impact health outcomes. We also know that if I was to ask you one of the major factors within this COVID-19 pandemic, if you look at all those things, was it all those things? Let me just think for a second. I'm going to say it, you always say, yeah, you're right. It was mistrust.
Yeah.
You see what I'm talking about? That mistrust was like a major character. It was like the headliner or is the headliner of this pandemic. For everything that happened, we said, and I'm saying we because I know it's my family too, it's friends of mine, we said, wait a minute, I don't think that's right. They couldn't be telling us the right thing about that. Let's look at the data ourselves, let's figure it out. And that's normal. And it was actually totally appropriate behavior on our parts as Black and brown communities that have been oppressed in this country. It's a normal, rational response to a system that is led by, founded on structural racism, completely normal. The problem is that it doesn't help with our health outcomes, okay? What it does is it stops us from being vaccinated. It stops us from taking the treatments that are now available for people if they're diagnosed, if they're high risk and are diagnosed with COVID-19. It stops us from maybe even going to the hospital and listening to whoever's there because he said, no, this couldn't be it. This couldn't be what they're saying it is. And it's a problem. So this issue of lack of trustworthiness of these institutions, of these research organizations, of these pharmaceutical industries is a major problem. And we need to do something about it. So what did we do? So we tried to build a foundation of trust very quickly. The problem is you can't build a foundation of trust quickly. If somebody has oppressed you for centuries, you can't build a foundation in a matter of months to get people vaccinated. But people tried. I mean, this is what every community health center, Whittier led the way, tried to be more transparent, tried to do clear messaging, tried to have trusted messengers who look like everybody out there, did community partnership, did all the right things. The issue is that in most cases, and I'm telling you this from experience, this is temporary. The reason why I'm saying that is because it was an effort that occurred during the setting of an emergency. What we need to do is we need to make this stuff permanent. And that's what I'm worried about. I'm not sure if everybody's on board, if all the money that's coming down, Frederica talked about the American Recovery Act and all this money and whatnot, if it is designed to make these changes permanent. Okay, so I think that is one important part of why I'm in this role and why I think that this is important work to do. I think let's go back to this issue of power momentarily. So from my standpoint, unless we shift power into communities, into the hands of those people who are most vulnerable, who are most at risk, we're really not going to change anything. And that may be the reason why we have these same disparities over and over and over. We have lots of programs. I think everybody's trying, everybody's doing what they can, but who has the power? That's what worries me. I would like to see more power in the hands of community. So what do we do to shift power? So one of the things that the Boston Public Health Commission has done is they've developed a framework about community-driven programming, community-driven policies, where essentially it's not the commission going out to the community and saying, look, we got this money, we want you to go deal with diabetes, here's the program, here's the playbook, go deal with diabetes. Instead, we say, look, community, what is it you want to do to fix the issues that are going on in your community? You lead the way. Here, you take the money. We're not going to keep the money. We're not going to have a budget that you can't see. We're going to be transparent. That issue of transparency, that's not going to be short term. That's actually be long term. That is shifting power. I think that's what needs to happen long term. And that's what, from my perspective, is one of the major reasons why we haven't addressed some of these health inequities. So this is actually my last slide. And I think it's a powerful one. Because when I looked at the theme of this Black History Month event, and it said, you know, we want to talk about Black wellness, we want to talk about being whole, we want to talk about how it is that we truly recover from COVID. Because the reality is that we are tired. I think a lot of people have suffered and they continue to suffer. And the question is, what is it that we do as a people? What do we do when we're in settings where we are tired and we are, you know, facing structural racism, and what do we do to actually stay whole, to be resilient? Well, we mobilize, we empower ourselves, and we create change. And that's a lot of what was done during COVID-19. My question is, are we going to be able to continue to do that? Because that is what will change the direction that we're currently going in. And that's what I'm calling on everybody to do. We have to keep the momentum up. Our numbers may be going down, but this is not over. All the energy that we put into COVID-19 needs to be shifted to all the other problems that are going on out there. And you know what? I'll stop there. Thank you.
So this is why we are on a fast forward texting message. We are tired, but we are hopeful.
Exactly.
And also we may not have all the power yet, but having powerful voices like you, and that's the difference with the Health Commission. And thank you for those of us who have been around. I've been involved in all those Health Commission task force since 1999. May the late Mayor Menino's soul rest in peace. We've done all those disparities, and many of those things we launched in 2004 have still not been implemented. But we are tired, we are hopeful because we have a powerful voice, and with your voice, we will be able to mobilize, empower ourselves, and create change. So let's attend the church of Dr. Bisola Ojikutu, isn't she? Pastor Bell has competition here. I mean, this is just compelling. So as a token of our appreciation, I'd like to invite Miss Eva and Pastor Bell to present the President's Award to Dr. Ojikutu. So again, it's one thing, did I see that, is that Dr. Oh, I thought that was Dr. Olutu over there. I was going to read it. It's one thing to have the visionary leadership, but the commitment, as much as you've said that I've responded to your messages, it's because you're asking the things that we've been craving, and the partnership and the responsiveness and the commitment. Not only do you bring a physician background, it's not about the education, it's about the commitment. But you've seen the unconscious bias, you've seen the structural issues, and I love how you outline, because I've seen explanations of structural racism, and it's overwhelming, but that's a simple one. So I will be sharing your presentation with everyone in here, and we'll post it online on social media because it's making a huge difference. So on behalf of the Whittier team, the patients, our board of directors, we would like to present you the President's Award for 2022.
Thank you.
What happened? We lost the screen.
Thank you. I really appreciate it.
Yes, it's you next. Eva. I'm just trying to set this up. So I'd like to invite Miss Eva to do a presentation of the Healthy at Any Age group as I set up. Come on, Eva.
Thank you so much, my hero. And she is my hero. She first and foremost give thanks to God for another day. Every day that we live and breathe is a gift. So first and foremost, we thank God. And we thank Frederica, Matilda, Virginia, Williams for her loving introduction to all of us and for all of us, and for all she does to make life better, not only in Roxbury, but also in Greater Boston, which extends beyond the boundaries of the city of Boston. She's made a difference. I'd like to also give thanks to the staff at Whittier for their dedication and all the work that they've done to keep moving and keep our Whittier world spinning. And Club 1290, I'd like you to stand. We have a few members of Club 1290 here. As Frederica has said, we range in age from 62 to 95. And we started off with 5, and then we presently have 16 members. Yes, it grows, it continues to grow. And we start our meetings, and they've arranged in approximately 2 hours. We have 2-hour meetings. During the winter months, we meet once a month. During the rest of the year, we meet twice a month. And we start with a prayer. We follow with meditation. We dance and we move. We celebrate birthdays. We donate a little bit when we can, if we can. We learn about aging and diseases, our diseases, and we fellowship and have fun. If it's not fun, it's not worth doing. That's the way we figure. But I want to give a special shout out and thanks to the people that have made a difference in our group and that have come out. Whittier's Dr. Stephen Wright. He's talked to us about COVID and the benefits of the booster. We have Ken from Bay State Physical Therapy who talked to us about movement. We've had Central Boston Elder Services. We've had chair massage and chair yoga by Four Corners Yoga. We've had Union Capital Boston. We've had Ren from Boston Acupuncture. We've had Dr. Ronald White demonstrating PBA meditation. He's visited us twice. We've had Boston Age Strong and Shine program counselors. We've had Whittier's dietitian, Caitlin Wilbur. We've had Jane from Whittier's Pharmacy. We've had Ashley from Whittier Street Center's Gym and Fitness. And so we thank all of them for making a difference in our program and in our world. And we have our next meeting is on March 16th. And as usual, we'll be celebrating somebody's birthday. And we thank you all for coming out and sharing this event with us. Racism is a public health issue, and we try to address it in any way we can. And one of the ways that as we grow older, we address it is by taking care of ourselves and keeping ourselves moving and keeping ourselves as happy as we can. And with that, thank you.
Thank you, Ms. Eva. So addressing racism, but also helping with life expectancy. Having a 95-year-old, Bruce stuff. Can I recruit you to join the group? My friend Bruce, I'm just teasing. Here's another friend from many years. So now again, as we celebrate Black History, I'd like to invite you. You should all have a printout, and it's on the screen as well. We're doing two things. Every year we sing the Black National Anthem, but we also read the African Pledge. And the reason the African Pledge is important as captured people, I was telling Eva last night, my ancestors were the ones who, after slave trade, decided we are going back. We want to be free, and we are here. And we just celebrated 200 years of returning to our captured land. So this, and it happened during Black History Month. So they were making history. So I'd like to invite us to stand, and maybe we'll have Pastor Bell. I'll give you the microphone. Okay. We're singing.
We're singing.
Yeah.
Can I get some sopranos out there? Got altos?
Yeah, no, that's right. No. Well, let's just go. Let every voice and sing till earth and heaven ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the God has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on till victory is won. Stormy the road we trod, bitter the chastening rod, felt in the days when hope unborn had died, yet with a steady beat, have not our weary feet come to the place for which our fathers sighed. We have come over a way that with tears has been watered. We have come treading our path through the blood of the storm. Out of the gloomy past, till now we stand at last, where the white gleam of our bright star is past. God of our weary years, God of our silent tears, thou who hast brought us shadowed beneath thy wing, may we forever stand true to our God, true to our native land. Okay, always touches me every item. Okay, now we read the African pledge as an African people. Okay, together. We are an African people. We will remember the humanity, glory, and suffering of our ancestors. We will honor the struggles of our elders. We will strive to bring new values and new life to our people. We will have peace and harmony among us. We will be loving, sharing, and creative. We will study and listen so we may learn. Learn so we may teach. We will cultivate self-reliance. We will struggle to resurrect and unify our homeland. We will raise many children for our nation. We will have discipline, patience, devotion, and courage. We will live as models to provide new directions for our people. We will be free and self-determining. We are an African people, and we will win, and we will win, and we will win. Okay, so lunch is served. Now that you feel hopeful and empowered, beautiful event. And refresh. This will do over here than over there. Can we do one with Bruce?
Yes.
Bruce, this is my, where you been? You big shot these days. Dr. B. Dr. Yeah. Yes. Yeah. I heard, yeah. Can we cut a cake for her? The cake. We'll take the picture.